Hey guys, so I've been assigned valvular disease, and what that is when there's an issue with one of the valves of the heart, either like the mitral, aortic, pulmonary, or tricuspid valve. Um, there's either like an issue with it, um, like the valves being narrowed, like a stenosis, or the valve has an improper closure, so the blood flows backwards. Um, the patient will more than likely present asymptomatic until it's late into progression. A murmur can be heard because of like turbulent blood flow. And if there's left-sided valve damage, it will cause pulmonary artery pressure um, and decreased cardiac output. Diagnostic tests that are going to help determine if your patient has valvular disease. They'll do a chest X-ray or a 12-lead EKG, echocardiogram. They may have them do an exercise test or angiography. We want to make sure with these patients that we are monitoring their weight and noting any changes to their weight. We want to assess their heart rhythm. Their heart rhythm is going to be irregular or they'll be bradycardic. We also want to assess for the murmur. We'll want to administer oxygen and medications that are coming up. And we want to make sure that the patient is conserving their energy and also limiting their salt intake. All right, so medications that are going to be prescribed and we will administer to this patient, diuretics. This is going to help remove excess water. There are going to be afterload reducing agents. This is going to help the heart pump easier. Inotropic agents, which is going to help decrease the contractility. And then anticoagulants. These are going to be prescribed with someone with valve replacement, AFib, or a left ventricle dysfunction. Therapeutic procedures. The patient may have a balloon placed. This is going to be a catheter inserted through the femoral artery and advanced to the heart. The balloon's then inflated at the stenotic lesion, and it's going to open to help the blood flow better. Or the patient may have valve replacement, and this is going to be where, plain and simple, the valve is replaced, the damaged valve is replaced in the heart. What we want to stress to our clients is, daily weights, and they want to make sure that they notify their physician if they gained 3 pounds in a day or 5 pounds in a week. We want to make sure that they're coordinating their activities in planned rest periods. We want to make sure that they're following their prescribed exercise program, that they are adhering to their dietary restrictions. So again, that low salt diet. They want to avoid caffeine and alcohol. We want to teach them all about client energy conservation. Fever should be reported immediately. And we want to make sure that we teach them the symptoms of heart failure, because heart failure could be a complication of valvular disease. Thanks.